Here's the only issue. NBMEs are nothing like the actual exam. What do you mean? Well, that's exactly what I said. NBME tests are nothing like the actual exam. The concepts are there, meaning the material is testing the concepts. So if you do well in the NBME, that tells all the physicians at your school, whoever's looking at these scores, and also yourself, that you are knowledgeable of the material because the questions are shorter. So there's not that many pertinent findings that are provided to you in the scenario. But I will give you a fact. Many doctors right now, students, physicians, maybe even you, take the NBMEs, score very well, 70%, 72%, 68%, still fail the exam. Do you know why? I've said this before, I'll say it again. Think about it. Well, Dr. Stavros said that the questions look nothing like the actual exam. Yeah, concepts are there. Okay, good. But the actual exam, well, it's 8 hours, 7 blocks of 40. The scenarios are usually very long. NBME questions, very short. So if you're used to running 5K a day, 5 miles a day, now you need to run 20, it might not work for you. A lot of students feel very good taking NBMEs. They go, I scored 72%, I have a 99% chance of passing. And they never actually stop and think, maybe I should start doing more blocks of 40, like 3 blocks of 40, 4 blocks of 40, perhaps a 5 block of 40, because the actual exam day is 8 hours, right? So be careful. To answer your question, doctor, thank you for your question from yesterday. Typically, NBMEs, anything over 65% as well. Clearly, the higher the better. But if you see that there's a 85% chance, 90% chance, 95% chance of passing in 7 days or less, you're in a good position. Good position. Good position, right? I love this question. Not your average doc 1. How to score 260 plus in step 2? I love that question. You can't answer it in 5 minutes. Okay, I'll do my best. A step 2 score of a 260. So for all of you out here to know, step 1 is a pass or fail. Step 2, you need a higher score, the better. It's 9 hours of an exam, 8 blocks of 40. You need to know all of internal medicine, and you need to review pediatrics, OB, gyne, surg, psych, behavioral science, and whatnot. So besides step 1 is just pretty much internal medicine. Step 2 is clinical knowledge. That's what's called CK. To answer your question in a few moments, because it might not help many of you because you have to see the bigger picture, or you have to know more of step 1 and step 2 and step 3. Step 2 is all about clinical knowledge. You need to know diagnosis, and you need to also know how to manage the patient. Many of my step 2 doctors, because we do private mentoring and tutoring one-on-one coaching for step 2, because it's a lot more involved with the scenarios and knowing how to answer questions. The majority of doctors that at the beginning, when they prep, they struggle is this. The top 2-3 reasons why they don't score 260 if they don't have certain guidance. The questions are very long, and they trip up on the management. So you know how to diagnose. You're like, I know what the condition is. Aspiration pneumo, or asthma, or community acquired pneumonia, right? You know the answer. Congestive heart failure. You know the diagnosis. Problem though is you know how to manage the patient, because all the answers look very good, and you have about 7 to 9 answers on average per every question, whereas step 1 probably just 5. So if you want to score 260 plus, give yourself a little longer time. Make sure you cover every specialty. Make sure you know how to diagnose, and make sure that after you do very well in your tutoring mode, and when you do a couple blocks a day, you don't go there on exam day and run out of steam.